Hello, this is Dr. Michael Shearer with Learn LODI, a free resource on how to market, treatment plan, place, and maintain LOCATOR overdenture implants. This YouTube video is aimed at describing the new Zest CHAIRSIDE Soft Reline Material. This material is really something that clinicians have been asking for some time. Many of those clinicians who don't feel comfortable with immediate loading of their LODI implants, or might just want to say, let's just play it safe for after implants placement rather than immediately connecting them to the denture. What soft reliner should I use? And Zest has answered that question for us because they've come out with this really wonderful silicone-based soft reline material that is just perfect for relining a denture after implant placement, or even with traditional denture patients if there's any areas of sharp ridges or any challenging situations that you would need a soft liner for. So I'm going to be demonstrating today using all of my standard instruments a reline of my overdenture right immediately after implant placement. I'm going to set that aside for a moment just to describe everything that you see in front of you in the Zest CHAIRSIDE Soft Reline Material pack. As you see here, Zest has very nicely put everything together in this convenient packaging. I'm going to go ahead and open it. Inside, right here on the top, is our instruction manual, including these nice big pictures to show us step by step of what to do. Additionally, a standard instruction sheet, as well as any of the information related to the details of what we would need to do for this procedure. Setting this aside for us, we'll see in here in our kit, Zest has also given us everything that we need to utilize for finishing and polishing the soft liner. 10 tips and a little mixing tool, a dish for applying our primer, and then finally, of course, in a sealed bag, our Zest CHAIRSIDE Soft Liner Material. I'm going to go ahead and open that up here for you, just setting our packaging to the side. It's a standard style PVS mixing cartridge, so it can fit into any commercially available PVS mixing gun, just like you see there. And of course, these convenient smaller tips that save on material, very easy to apply to our soft liner material, lining up our little marks. And this should feel very similar to what some of the other PVS materials that fit into the CHAIRSIDE line. Now, since this is a silicone-based product, I'm going to zoom in a little bit, there is no true bonding of the soft liner to the denture without the use of a primer. So Zest has ensured that a primer is included in the packaging for the soft reline material, and this is really critical to use to ensure that the soft liner properly bonds to the denture. First thing that I like to do is go ahead and open up this little individual baggie, and inside of here is just this really convenient little dish. As I take that, I want to put this on the inside of my primer, so that way it's now able to drop out of that container or of that bottle. And additionally, showing you inside of here is all of the finishing burrs that we would use. This is more or less just a coarse point. It's a black in color, but this is what you will use initially. And then any of the finishing procedures will be utilized with this finishing wheel. One thing that you see here, it comes with a couple of these little rings. You can assemble on any sort of mandrel, which I've already put into my baggie here just to be on the safe side. Now, this is not included. It's really pretty much any standard mandrel that you can buy from any of the dental suppliers. I can unscrew the mandrel and putting on my little ring, placing the ring on one side or the washer, and now just going right through the center of this little finishing wheel. Sometimes you have to push kind of hard. Taking our other ring, putting it onto the end, and then tightening down our mandrel until it's finger snug. So I'm going to put these two aside for now. and I'm going to describe our clinical technique of what we would like to do here. So imagine this situation where I just placed these 4 LODI implants on my patient. I have an existing complete denture. I've already initially done some of the hollowing out of the inside of the denture just to simplify the procedure. But if you remember, and you can review on some of my other videos, I just take a little bit of the Zest CHAIRSIDE bite registration material, place it on the inside of the denture, seat it in the mouth until you get a few marks on the underside of the denture. I've already gone ahead and created those holes. However, you can of course remember that we're going to take out our denture prep and polish kit, remove our locator recess spur, and use the locator recess spur and create our holes just like so. Now at this point, what I like to do is I like to go ahead and try our denture back onto the edentulous ridge, making sure that I'm not contacting anywhere or any areas of heavy locator abutment contact. So now what I need to do is I need to prepare my denture for working with the CHAIRSIDE Soft Reliner. So I zoomed in a little bit so that way you can see some of this preparation step a lot better. What I like to do is go ahead and take out from my prep and polish kit the trim burr. I'm going to use my trim burr and I'm going to prep the outside part of my complete denture. And if you're following along, that's right here on this step right in here. And sometimes what I like to do also is use some round burrs on the inside of the denture as well, just to aid in mechanical retention. However, it's not critical. Assuming that you have these recesses in this position, most clinicians are just going to reline with the soft reline just over this. However, it is important to bevel these borders, which I'm going to show you right now. Taking my trim burr, I'm just going to trace all along the edge of the facial aspect as well as the lingual aspect of this complete denture. And continuing on to the lingual. Now I've successfully beveled all of my edges. As you can see, there's this little area of that kind of matte finish to the denture versus the shiny finish right in here. Very simple to do using my trim burr. So now once I've finished with my beveled edges, I just take a little bit of air, dry off the entire denture. Sometimes you have to run it underneath some water just to ensure that all of the dust has been removed. Now the important step is that we're going to go ahead and take our CHAIRSIDE primer. I'm going to take our CHAIRSIDE primer and I'm going to go ahead and place a few drops into this dish. Just kind of leaning at an angle, and you don't need a whole ton because what's important is you want to use the right amount of primer, not too much. Additionally included in our soft reline box is these convenient little brushes, which I'm just going to go ahead and take a pair of scissors and open so that way I don't bend them. And removing our little brush, it's just the right size to go ahead and dip into our primer. And now, very carefully taking in a gentle motion all the way around our denture, starting at the borders, and ensuring that the primer is evenly coating the entire surface of the denture. Now, one thing that you can do is you can go ahead and adjust using your trim burr the intaglio surface of the complete denture, just to ensure that you have proper space for the CHAIRSIDE Soft Reliner. I'm showing this as an example for many clinicians who say all I really want is some soft reliner right around the locator attachments on the LODI implants, which is usually the case of where I am after a LODI procedure and if I want to do a soft reline as opposed to picking up my implants immediately. Allowing this to set completely, usually about 30 seconds to a minute just on the benchtop. Now that the primer has had sufficient time for it to set, I'm going to demonstrate utilizing the CHAIRSIDE Soft Reline Material now. As I mentioned before, it's a silicone-based soft line material, and it's soft enough to be perfect for those immediate cases right after implant placement where all I want to do is a soft liner. It's very simple, plugs directly into my standard PVS auto mix style gun, and the yellow tips are included in the packaging. You have about 2 minutes of working time while this is being applied to the denture, while you're mixing and carefully placing inside of the complete denture, and then the total set time is about 5 minutes. So what I'm going to do is again show you where we've provided those areas of relief within our complete denture. I have my patient that I placed my LODI implants on, and what we're going to do is I'm going to start dispensing along the border of the complete denture all the way across. And just following it just like you would use border molding material, and on the lingual slope. Just one nice gentle motion coming across into my recesses and the intaglio surfaces. And that's pretty much good to go. Now additionally, inside of our packaging you have a little mixing tip, and this is just almost like a spatula if you need to fix a couple of these little areas just to ensure you've got sufficient liner material, or if you want to move some around, you're more than welcome to do so. It has the nice body and consistency so that way it's not dripping or drooping in the patient. And additionally, it's flavorless and odorless, unlike some of the methacrylate-based self-curing materials that's available on the market. I'm going to take this and very gently seat it onto my patient, ensuring that I've got even pressure all the way around. Now at this stage, I'd have the patient close down into the MICP or into the centric position, and I would also do some very gentle border molding, rubbing the cheeks from the side, and the lip, just gently tugging the lip. And then after the patient closes down, have the patient very gently swallow, stick out their tongue, move it side to side, so kind of like this, and then this. And then additionally, I would have them lick their upper lip to ensure that the proper lingual border molding was occurring. And the cheek side was already done. Ensuring that I've had the patient close into their proper position is going to ensure that you have not increased the vertical, and you're going to have minimal chances of having to do any sort of bite adjustments afterwards. This will differ quite a bit from our traditional chairside attachment processing material pickup technique. The soft liner, you want the patient to close down into centric. It just will greatly simplify your procedure. This takes about 5 minutes in the mouth for it to set. I have the patient sitting the entire time. Let me zoom in a little bit just to show you. I'd have the patient closed into centric or into MIP the entire time, just to ensure that there wasn't any chance of the prosthesis lifting. Once this is completely set, I'll remove it and show it to you. After approximately 5 minutes, the CHAIRSIDE Soft Reline Material has had a chance to fully set up. I'm going to go ahead and very carefully tease this denture apart, and sometimes it can be a little bit strong. In the mouth, you're going to have a lot of saliva that won't necessarily cause it to be this retentive, at least in the mouth. There we go, very nice and carefully out. Beautiful. As we see here, we've sufficiently captured all of the locator abutments in place, and also we have nice coverage pretty much everywhere on the complete denture. There's a series of instruments that you do want to use here. First and foremost, we're going to be utilizing just a standard scalpel blade. This one is a laboratory style number 25 blade. What I like to do is I like to go ahead and start just trimming the soft reline material around the borders. Keep in mind that this is on a benchtop demonstration on the laboratory. You would have a better border molding control, and it would actually kind of thin out like this over the edge of the denture in a actual patient. But what I'm going to do here is just demonstrate as if I were doing this. There we go. And I usually like to hold it at that angle just so that way it'll clean up nicely. And just peeling it apart as it cuts. Cleanup here is really pretty much a breeze. With this material, you'll see how easy it is to clean up. The most important thing is you want to make this comfortable for the patient to keep in his or her mouth. You're looking for any areas of just these like little fins, any areas of sharp show through. Once you've sufficiently trimmed everything up with our 25 blade or any sort of scalpel blade, either a 15 or 12 blade, we can go ahead and remove any sort of burr that we have on our handpiece and put on our coarse point. The coarse point is included in the kit, and you just take this at more of like a medium speed and just rubbing the edges of the CHAIRSIDE Soft Liner. And what you're going to notice is this really cleans up, very simple. All you want to do is just take this and start to smooth out these edges so that way it's comfortable to the patient. Sometimes it can be effective as well if you have any areas that's extending way past on the lingual slope, especially in those retromalohyoid extensions. You can take just a simple pair of scissors just to help trim up those edges. You'll see that mostly on the posterior aspect of the complete denture. Now what I'm going to do is go ahead and take my finishing wheel by removing my coarse and placing on my finishing wheel. And this is going to help finish up the cleaning up process. Using my finishing wheel, I'm going to take my finishing wheel at a low speed and just rub the edge of the denture from the edge of the liner inward. I don't want to come this direction because it's going to spin that direction. What I notice is that I want to pull against the liner, so that way I'm not peeling the liner away from the denture. And on the intaglio and the lingual surfaces, and sometimes you can get it going a little bit faster, and alternating between medium speed and a high speed. Okay, this is our final appearance after utilizing the finishing wheel. Now what I'm going to do is take this to my sink and just get it cleaned up. After returning back from the sink, you'll notice that the final finish of the CHAIRSIDE Soft Reline Material is really pretty beautiful. You'll notice the first thing that should jump at your eyes is the pink color. The pink color blends in very nice, very beautifully with the acrylic denture base. And you'll see here that patients will find this very pleasing to the eye. Additionally, it has a very nice soft spongy finish, which is perfect for those locator cases or those LODI cases where I place my implants and I want to be conservative with a soft reline. You'll notice that when I place it back onto my patient model, it holds with just a little bit of retention, enough that way the patient's comfortable, but also maintains that sponginess that patients will really find comfortable during the transitional time period or the post-operative time period. And finally, unlike most other soft reline materials on the market, this silicone-based soft reliner will stay soft for the entire time period in the mouth. Now, this is really important too for those immediate cases or right after extractions, because that will not harden around the existing locator abutments on the LODI implants at just the wrong time. So imagine this, if you're using one of the other methacrylate-based resins on the market, even though they're soft initially, after the first week or two, they're incredibly hard. And that critical healing time period is occurring right after about the 1.5 to 2 week mark up until 6 to 8 weeks post-implant placement. Now, because it remains soft, the CHAIRSIDE Soft Reline Material is going to impart a significant amount of less direct force to the implants. If you want to be even more cautious, you could of course hollow out using your coarse adjusting burr on the inside of where the locator abutments is, ensuring that you have no contact with the locator LODI abutments. However, I haven't really seen that being a problem in my office. I like to keep it just like this, seat it back in the mouth, and complete it just like that. Now, of course, with our patients, we have to be careful with any sort of denture home care. It's important to make sure that we just encourage our patients not to put this in with any aggressive denture cleaning fizzy tablets, but just to rinse this with a sponge or gauze under running water. And of course, they can use some light materials to clean the denture with, but I really recommend just water. This is Dr. Michael Shearer with Learn LODI. I hope this video has been educational and informative about the new Zest CHAIRSIDE Soft Reline Material. Stay tuned for additional videos.